Welcome to everybody. We are really, really excited of sharing today the outcome of the revision of the practice toolkit and discussing a little bit with you some of the issues that have come out and some of the reflections that we have been doing over the past year in many ways. So I think that we can, yes, thank you, Lorna. Okay. We can, yeah. So I think that we could, the only thing that we can be sure of and that has proved to be valid is that we have faced so many changes. So we've really gone through so many different phases. And if you look at it from a European perspective, this is even more so. So there's been shifting in different countries, and within different countries, different regions, different rules, different levels of the pandemic. And this clearly has had an influence on the service providers, on the services that were being provided, and on our clients, on the men and women that are in situations of domestic violence, okay? We know, we perceived immediately at the onset of the lockdown last year in March that there would be a situation that would create an at-risk situation. We know that even before the COVID-19 pandemic began, 1 out of 3 women were experiencing violence. So we were afraid that with the issues around lockdown, but not only that, also we now know, but we suspected then that the services that support women, all the ways of also getting support to get out of violence could be compromised by the lockdown. So we know that the calls increased. We know that we know in a very sort of last sense here, because we are still really uncovering what the specific consequences of the violence have been throughout the last year. Okay, and so as we looked at what was happening in different regions of Europe and what changed over the course of the year, we have had countries in which there has been extended, for example, closure of the schools, which has meant homeschooling, which has meant obviously in situations where there are already tensions and difficulties, increasing stressors. As with sort of job loss, alcohol consumption, so all of these issues have been changing and have been critical over the past year. March last year, as we were sort of facing the first wave of the strict lockdown, we issued the guidelines for working with perpetrators, in which basically we focused on the intervention shifting to a crisis management mode and ensuring the safety of victims, and looking at sort of increased practices to make our practices safe as possible, shifting a little bit away from the core activities that we have in programs, and making sure that all the interventions that we were doing were safe. But of course, I think nobody thought at the beginning in March 2020 that this lockdown, especially at the beginning, that this lockdown would be so long, and frankly, within certain term of ending even now. And so progressively, we felt the need to understand what was happening over the year. Clearly, perpetrator programs had a varying degree of what they were able to do. In some countries, there were regulations that allowed perpetrator programs to continue as essential services, so they basically were still doing in-person work. Other countries in which it was completely online or on phone holding. So we were curious to know over the course of time what has happened this year, how are programs responding to this, are the same recommendations that we made at the beginning still applicable, and if they are applicable, what does it mean to do a crisis intervention for a year? What have we learned? Because regardless of the fact that for sure this year has been really difficult, it's also brought out a whole lot of possibilities that we didn't even think were possible. And so that also brings to the question, how do we evaluate what has been done and what works, okay? So we have heard a lot over the past year, questions around, is online, individual or group work equal, better, worse than in-person perpetrator work? And there is evaluation research that sort of is in progress, but we still don't have a final question on, a final answer on this, and maybe we never will. However, in reflecting on this question and on the many questions that have come out, we have also thought that maybe we should be shifting the question. Maybe there's a better question that we can be asking. And I'm going to leave you with a little bit of a cliffhanger on what the better question is, because we'll go back to answer it after we've somehow discussed and shown and worked together on this new document that we are going to be launching today. So as a first stepping stone, so let me introduce the team that's worked on these guidelines. I've been working with Berta Vall, that is the Research and Development Manager at WWP, and with Sandra Jovanović, that's the Training and Capacity Building here at WWP, together with myself, Alessandra Pauncz, the Executive Director, and with Lorna Cannon, that is our Communications Officer, and that is supported and help us every step of the way. And when you see the document and see how interactive and beautiful it has been, you should thank her expert hands for that. So we are going to take you on a journey through the guidelines, an interactive journey, because as much as this is going to be sort of a sharing of what we have come up with in our work with you, it is also a reflection journey that we think, and we started in the toolkit with questions around what have we been doing with our programs in shifting our practices, and questions that have to do with how we as programs have been working on this. And I'm going to now pass over to Berta, that's going to give you a little bit of context on the methodology that we've used for these guidelines, and then we will continue our journey. Over to you, Berta.
Thank you. So what have we done? What were the steps that we kind of took forward to develop these guidelines? First, we conducted an online survey that was sent to all of our members. And in this survey, we were asking questions related to the host country of the program. So where was the program based? We also asked questions about the restrictive measures that were implemented in the countries during the pandemic, and also the delivery format adopted by the program. So if the program had to move online, if they stayed face-to-face, if it was focused, if it was a group treatment, or if they moved to individual treatment. So all these questions. And then we also asked about the feelings and the challenges that they felt that they faced as professionals during the pandemic. And the last question we asked if there was a willingness to participate in a further focus group session to discuss all these issues. So we received 61 answers altogether, which was quite good, and we were quite happy of this answering rate. And 26 of those 61 answers expressed the interest in participating in the focus group sessions. And so we invited all these 26 participants. We finally got 22 participants in total. So we did 3 different focus groups with more or less 6 to 9 participants in each session, in each focus group. And we had divided the focus group in 3 main delivery formats adapted during the pandemic. So we had, for example, programs that moved completely to online work during the pandemic. Some other programs that stopped the work so that they have to stop the work at least during the strict lockdown. And some other programs that moved to offering different kinds of support, for example, via phone calls, or maybe that conducted a mixture of online and in-person work. So we had this kind of 3 different delivery formats in the focus groups. So these sessions, these focus group sessions took place during the between the 12th and the 18th of January. 2 of them were held in English and 1 of them was held in Italian. And the sessions were more or less 2 hours long. So we had participants from different countries. I'm just going to mention some because I think it's important for you to know where this information comes from. So we had participants from the UK, from Italy, from Spain, from Germany, from Kosovo, from Croatia, Greece, Ireland, and Scotland. And we did these sessions via Zoom, and we also recorded all these sessions. So what did we try to discuss? I don't know if you can see it in the slide because there's something popping out, but so what did we discuss in the focus groups? We focused on 2 main topics. The first one was the effects of the pandemic on the program delivery format. So we asked what changes did you have to do in your program? What recommendations would you do now that you have had to face these changes? No? For example, if a program had to move online, so what recommendations would you give us now that you have had the experience of moving online? And lessons learned in general. And the second topic that we covered was the effects of the pandemic on the life and on violence. So we wanted to know how this pandemic has affected the life of the men in the program, also their partners and their children, and how the pandemic has affected the violence. So has this violence changed in any way? What kind of difference have they faced in terms of violence and the feelings of the men also? So these were the kind of the 2 big questions that we asked in the focus group, and then the discussion was facilitated by one of the 3 of us mainly. So this is for the methodology, and before going to the theory and explaining you the results that we have had, we wanted you to do an exercise. So if we can see the next slide, we would like you now to invite you to think and reflect and discuss about the challenges that you have faced during the pandemic and the lockdown in your work, in your programs. And also to reflect on what solutions or actions did you take to overcome those challenges. And our idea is to divide you in some breakout rooms, and you will have about 10-15 minutes. So we don't want the idea here is not to have a very long discussion, but for you to gather some ideas of the challenges that you have faced, and then we will try to mirror those challenges with the ones that we have covered in our guidelines. So it's a way to also kind of start the discussion in an integrated or coming from your own challenges. So the idea is that you will discuss those 2 questions in the breakout rooms, and we kindly ask you also to choose one spokesperson. So this person can gather the main challenges that come through the discussion in the group. And then when we come all back together, this spokesperson will be able to kind of briefly review the main challenges and some of the recommendations, or if you want solutions, maybe not solutions, but recommendations or actions that you took to kind of face those challenges. Okay, so now it would be the time to share some of the challenges that can have come up in each group. So if we could hear the ideas that came in group number 1, if you have a spokesperson that would like to share the ideas that you have been discussing.
Should we go? Should we unshare the screen so that we can actually see participants as they talk?
Yeah. Okay. Let's unshare the screen. Yeah. So room number 1. I don't know if you are aware of the number of rooms that you got, but it was Benjamin, Carol, Daniel, Dawn Clover.
Hi, it's Dawn. I'm not sure if anybody else wants to speak. I'm more than happy if somebody wants to take the lead, or if you want me to. We had a really, really interesting conversation, to be honest. And I think, you know, we're based in the UK, and I think it was reassuring to hear that's just the global impact. We had members in the group from Lebanon, Croatia, US, and I just think, you know, just hearing the similar challenges was really helpful. Our Croatian colleague talked about the lockdowns, using telephone contacts, which we ourselves did, and there was a pattern of using telephone. Groups are prohibited in Croatia at the moment, so it's all one-to-one over telephone. The challenges with that. Lebanon, there wasn't many men on the programme, and phone and Zoom had been utilised again really effectively. Our colleague in the US, Illinois, there was geographical implications due to the size of the area. They had child facilitators, which for me is amazing to have so many facilitators on staff. And they've got 100 men in the programme, 2 women's group, and they've used and managed one-to-one telephone calls to sort of work with the men over crisis management, stressors. They've attempted to do some group work over the telephone in Illinois as well. And they also found engagement in some ways was more positive, which I hope, like Carol, than actually having men in the room. Ourselves in the UK, we've actually moved into small groups next month, so we'll be having to 5 men. I think the stressors, you know, which have come through during the pandemic have just been so extraordinary. I think to overcome that, I know ourselves in the UK, what we've done is we've had men actually come through for one-to-one sessions since last May. We've saved systems of work with face masks, hand gel, disinfecting the areas, etc. And we're just really looking forward to starting small groups. Part of the reason for us having small groups of 5 is actually due to the facilities we've got here and the size of the rooms, but we're looking forward to moving that on now. I'm not sure if any of the group members have got any other contributions. No, thank you.
Thank you. I think this is a very nice summary of the complexities and the differences that we have in different countries also. So I've heard that some of the countries have moved to the telephone contact, either individually or even group work. I understood correctly? Okay. So, and I, sorry, I've also heard that some experiences were to move to smaller groups, no? Some of the actions that you took to overcome the challenges of the pandemic was to move to smaller groups also, or to do face-to-face intervention in individuals or one-to-one interventions. And
yeah,
okay.
Yeah.
Okay, thank you. So
thank you.
We will come back to those challenges that you've mentioned also. So let's see group number 2. There was Emma Yatmaze, Ilir, Irene, and Johanna. If one person from this group could maybe share the thoughts and challenges.
I was taking the notes, so if that's okay with everybody in the group, I could maybe summarize the people contributing. So this will be also mainly a UK-based perspective, and this is the challenges that I noted down. So the main challenge that was highlighted was the increase in the numbers of people that have been referred to the service, and this was one of our UK-based service. So there's been lots of referrals, especially from the police during the pandemic and the lockdowns, and that resulted in a creation of a long waiting list. And also because of the pandemic, some face-to-face work had to start for a period of time. So the way this has been addressed was really through expanding capacity. So the service capacity was expanded so that the service was able to run more groups. The groups had to be made smaller because of online delivery. And the service in question ran up to 18 perpetrator groups by week, just to reflect the huge capacity that was needed. Also, what was increased during the pandemic was the contact with survivors. So the contact with survivors was made more often, and it was more intense. And again, the feedback from survivors was that really that was a lifeline, because that offered them the additional access to support, but also just knowing that there's somebody out there, you know, being on their side and supporting them made a huge difference. And I think the conclusion was that all that has resulted in better engagement from the perpetrators and also from survivors. So I don't know whether anybody else from our group wants to add anything to what I've already said, if I missed anything.
No? Okay, so thank you. That was also very interesting. So there's some challenges on the increase of number of referrals, and that's increasing the long waiting list. No? So you solve this by increasing or expanding the service capacity. Also some face-to-face work, or the face-to-face work stopped for a while. So that also has had an impact to moving to online work. The increased number of the increased contact with survivors as a helpful action in this moving to the online work, no, as a way to keep this safety and to do these safety checks more often and more intensively. So we will come back to this also. I think this is a very interesting action or recommendation. And also you have pointed out some kind of good outcome or unexpected good outcome of this situation, which is the better engagement of both the men in the treatment and also the survivors. So we will come back to this also at the end of the guidelines. Okay, thank you. So let's see group number 3. There was Alistair, Anka, Dean, Ekaterine, and Monica Dottir. So if anyone from the group would like to share the ideas that came up during the discussion.
I can do that. We didn't appoint a spokesperson, but I just volunteer. We didn't get through both of the questions that were posed there, and we got in a very fruitful discussion about related things. And one was that the current situation actually may open up an opportunity for increased outreach to those that would not have been able to attend in person in rural communities and isolated communities, with all the difficulties that are associated with that, including the technological poverty these people would have, and stigma and everything else. But that is an opportunity to look forward, and an opening that perhaps we haven't been thinking about enough before. Another thing that came out very clearly is that when there are well-established pathways for a referral into the programs, they continue to function well, and that's I think an important message. Another was that in the first 3 months there was a decrease in services, and mostly turning to one-on-one. But it was interesting that then the men in the programs demanded that they should come back into the groups because they needed peer support, or they benefited from the peer support. So I think that speaks very strongly on the advantages of the group format also in this modality. And that these groups needed to be smaller than in the face-to-face setting, but they were still co-facilitated, which is an important thing that we should think of, because there is in an online setting, there are these technological things that somebody has to take care of, like admitting people and breakout and whatever. So that's another aspect that some of us haven't been thinking of. Yes, I think that's what we have. Yes, and there was one thing that didn't come up very clearly, and that is that that during the lockdown, when with the freedom of movement is very restricted, is one thing, and people cannot really gather and to go to the services or run a group. But when the freedom of movement is lifted, there may not be reason why not to resume to the face-to-face groups, acknowledging the limitations enforced by the authorities on the size of the groups or size of the gathering. So I think that's. But please add from this group. Please add to what I was just reporting.
Okay, thank you. It seems it's well summarized, the discussion. So it's interesting because here you also come up with some kind of good outcomes of this new situation, which is to open up this opportunity, you know, of having more, increase the outreach in rural areas, and depending on increase the geographical reach. And also we have the same idea of the decrease in services, and to do smaller groups also when moving to online. So we will come back to this also in a while. So let's see in the discussion in room number 4, what were the main ideas?
Okay, I'm feeding back on our group. So we had services based in the UK, in Malta, in Georgia, and a colleague based in Scotland. So the challenges fell into mainly 4 different areas. One was around staff confidence, practical issues, engaging and retaining clients in services, and safety. So one of the first things we talked about was the initial, and this is a kind of a staff confidence issue, being faced with having to change pretty much everything that you do, and you know in terms of the risk assessment and the processes, having to change that with very little notice. And there have been lots of solutions, and that's been overcome, but it's been compounded by the guidance and the health guidance and lockdowns, successions of them. So feeling that you're still not on solid ground because things could change again. So that's been a challenge. In terms of practical issues, we talked about two in the group continued to deliver groups, or certainly there was a commitment to continue to deliver groups. And one of the particular challenges for one member of the group was about using a virtual calling platform that the group members could only use, but as a facilitator it was very difficult because it was only accessible on a mobile phone. So trying to facilitate a group discussion or a group of 5 people on a mobile phone, and that experience wasn't a very positive experience. Another issue was around working with clients in areas of deprivation where data, Wi-Fi, and access to what you need to use online platforms was a struggle. For myself, a practical issue was around venue space. In the same way we've been talking about outreach work, actually finding appropriate venues in the community when at times most venues were closed, whether they were public venues or kind of children's services venues, things like that, they were closed. The next thing we talked about was about retaining and having to overcome the challenges of clients maybe not wanting to communicate or engage in online sessions, or actually managing a dip in engagements where people were kind of falling out of the services. And then from a safety point of view and an assessment point of view, a colleague in Portugal raised concern about doing first appointments and actually not having access to, you know, if it's not face-to-face, body language, all of those are those type of things that we're taking into consideration in our assessments, that not being there. Being able to gauge the honesty of a client when you're talking to them on the phone, and that being quite difficult, and actually knowing that they were in a safe space. And that from a safety point of view has been a challenge in terms of continuing engagement, but monitoring, making sure that from a safety point of view, the survivor and children are safe and well. In terms of what solutions we came up with, kind of very practical solutions. So one of the services in the UK to overcome the data and Wi-Fi issue, they had a budget to provide pay-as-you-go top-ups. So they could provide to their clients the means, the financial means to access sessions. Moving things to phone, Zoom, online, and that being a way of continuing to engage. And certainly for my service, we started doing walk and talk sessions, which we'd never done before, but just making use of open space and just finding new ways of continuing to engage clients in kind of what was available at the time. Not sure if anybody else in the group wants to add anything to that, but hopefully I've covered most things we talked about.
Okay, thank you. Thank you. So I think this kind of summarizes very nicely what we want to explain now about the main challenges on safety, on the staff competencies, on also on some more practical issues. So if we can go back to the presentation, I will very briefly, because we have now 10 minutes, I'm aware of the time. So I will very briefly kind of summarize the different challenges that came up in the focus group and some of the very practical recommendations that also kind of came up in the focus group discussions. So we've received 5 main challenges. We have challenge 1, which is when moving to online work. So we have this first challenge 1, which was the worry that maybe the safety of the survivors and the children could be diminished, or that it could be challenged during online work. No? So this idea that now we were reflecting on the implications that having this online work can have an impact on the family, because, for example, men can leave the program feeling tense and being there's no transition between the programs and their homes because they are in their own homes. How to maintain victim safety or survivor safety during the partner contact if there is a strict lockdown and they are both in the same home. So how can we do these procedures, these these challenges that are foreseen. So some of the recommendations for this specific challenge that came up in the discussions in the focus group were, first of all, to do more frequent risk assessments in order to assess the impact of this intervention. So we don't need to put this, Lorna, let's keep it simple. So as this kind of online work is very new, is a very new experience for perpetrator programs, it was said also in the discussions that this continuous risk assessment can help in monitoring the risk of the intervention taking place. So we can really benefit from doing much more frequent and intense risk assessment checks. And it was also suggested that this risk assessment could be held during individual sessions. So in the individual sessions at different time points, and also to include assessment of the situation of the children. And also it was suggested that we could kind of develop together with the men in the program a plan of what to do if a session triggers some feelings. So what could they do even if being in lockdown situation, even if being at home. So what can you do if the situation triggers some kind of feelings? So to do this kind of plan, to develop this plan together with the men in the treatment. And also it was mentioned, and this is also related to this victim safety, to gather regular input from the victims about their feelings, specifically with the online service provision. So how are they feeling with this delivery format? For example, gather information if she can hear what the partner is saying during the online sessions, if this situation is frightening her. So kind of doing this taking these regular inputs for this specifically delivery format, no? And also some during the pandemic or during the strict lockdown, there were some options for contacting the victims in a safe way, which were considered very useful. For example, to find a suitable moment in which the victim can speak more freely, or if you know that she's at work, or for example, moments in which you know that they might not be together at home, or if you cannot call her, then exchanging some SMS messages, for example, to find a suitable moment to call her. So this was also posed as possible recommendations for this challenge on safety of the survivors and the children. And then some of this has come up also in the discussion. So I'm moving now to challenge 2, in which there was this worry on how can we ensure that men use this virtual space in a non-manipulative way, no? In a non-potentially dangerous way. So how can we kind of ensure that this is used as a safe space, and how can we ensure confidentiality also during online interventions? So some suggestions and some recommendations here were focused, very practical recommendation was to record all the sessions, so that then the professional can go through the sessions if there is some worry that there at some point there has been some manipulative or dangerous attitude. So we can really double check if this has happened. And also, and this has also mentioned, to try to include, when possible, some in-person sessions to kind of do this engagement with the participants. It was also mentioned about this importance of the body language, no, to make this a safe space. So if we could introduce, even if doing this online work, some in-person sessions to kind of engage the men in the treatment, in the program, that was also reflected as a very important practical recommendation. And then also, in order to ensure this, to ensure confidentiality, it was also mentioned that it was very important to set very clear rules and agreements at the beginning, specifically focusing on the online treatment situation. So, and specifically focusing on confidentiality. What will be done, how it will be done, and how will we treat the confidentiality of the sessions given the online format. So focusing specifically on this online format. So about challenge 3, and this has also been mentioned, no? How can we help men to engage in this new treatment setting, no? Because if they are at home and they might be too relaxed, or they might not be in an appropriate mood because they are at home, or maybe they get tired because of the online setting, as we all are sometimes, or they might not have a space in their homes, appropriate space from which to follow the session, or they might have limited access or command of technology. So some of the recommendations here, there were mentioned already some of the recommendations, and I will just repeat some of them and give some new recommendations because I think it's important also to mention them. So again, the importance of setting very clear rules on the development of online group work, as we would do on the face-to-face group work. Also, it was mentioned as a very positive outcome or recommendation for this challenge to do shorter sessions with less participants. So this has already been mentioned also here. So to have less participants for the online group, but also to shorten up the sessions. And it was also mentioned as very important. So it's very important to set very clear rules for the online format, but also at the same time to be flexible in some of the rules that we think that they are not so important. For example, to have an adequate space to follow the session that is safe for the victims and for the children and the survivors at home, that's very important. But if this space and safe space for the man is, for example, the car, so we should be flexible with that. So flexible of where is this safe space, so to speak, no? And also it was mentioned in terms of these literacy issues or challenges that the man might have when moving to this online setting. It was mentioned to kind of to get some time to help the men to set up the accounts, to download the necessary apps, so to do really like to help them on this online setting, to navigate through this online setting. So we have challenge number 4 also, that I'm not going to review because we don't have much time here, but you will have the full toolkit to review by your own. Here we are just going to give some ideas. And I just want to mention very briefly challenge number 5, which I think it has been mentioned by the last group. And I think this is also an important challenge. So how do we as professionals face also this new situation? No? How do we adapt to a new activities or to a new way of doing our work, and also how do we adapt to the pandemic situation, which we are not, it's also affecting us as professionals. So it was, we had very nice and concrete recommendations here to do, for example, online chats, to do regular updates with the facilitators that I think that are very interesting. So you can also check them in our final guidelines that we will share with you. So these are kind of the main ideas of the challenges and the main recommendations that we came up with in the focus groups. And now I will give the floor to Sandra.
Thank you. So as we know and we saw in this discussion, there are many challenges around how to do safe and accountable perpetrator work in the times of pandemic. But also we are over our first year of the pandemic, and we find a lot of ways of how to adapt to these circumstances as it was happening in the group discussion. Now we are ready when we are talking about different challenges and what is hard and how to overcome it. We are also ready to talk about what I call the brighter side of COVID-19 perpetrator work, and also about some of the open questions that we think that it's really important to reflect on and highlight and think about, and we will try to initiate this kind of reflection in this last half an hour of our webinar, but you will find more in the guidelines. So as every black has its white spots, like it's presented in this yin-yang programs who adapted to these circumstances and adopted some new ways on how to provide perpetrator work, whether online or blended approach or something else. they have discovered that there is a brighter side and there are some advantages of this kind of work. So if we could move to the next slide, some of them were mentioned by some of the groups, and it's really important that we are aware of them. And I think that we are in this stage of the process where we can also talk about this and think, when this situation changes, what can we take as some learned lessons and some good outcomes that maybe we can use in the future, especially when we are talking about potential online work. So what are the things that went well? What did service providers say that went well and that they were happy with as an outcome of an online or a blended approach? This one was mentioned by one of the groups, that some men are more cooperative and willing to engage. And a lot of professionals experienced this, that some of the men are more cooperative because they are in their home, they can be more relaxed, it's easier for them to engage in an online format, but also the fact that men and facilitators of the groups have something really in common in this situation. They are all in the lockdown and they are facing similar challenges. This brings really common ground to which they can connect with the facilitators and create some open atmosphere to work in and to build upon. So a lot of programs experience that some men are really more open, more cooperative and willing to engage. Involving men who usually stay out of our reach, this was also mentioned. And this is a huge benefit of this kind of work. Some of you mentioned that men who are geographically away from the places where the services are provided, we know that perpetrator programs are not usually provided in every city or in every region. So this really enables us to involve the men that are not so close to the place where we are doing our work. And some of the programs, for example, in Russia, decided to go to the online delivery of the programs even before the pandemic, because they wanted to have a wider reach. But also men who have non-flexible working hours, who can't really easily fit into regular programs with all the framework that they are conducted in. This is something that's really helpful. Also, some of the men who have a huge resistance to do in-person work and to engage in a group, some programs found that this is a good way to engage them and motivate them, and then to transfer to in-person work when possible. One of the things that was, I think, also mentioned, but really highlighted from almost all of the programs that we spoke with, is that multi-agency work is improved. And we know that perpetrator programs, as all other services in the field, can't really be isolated, and that multi-agency work is, and perpetrator programs within this multi-agency context, is something that makes difference. So in the pandemic situation, this was really improved. A lot of programs reported that now they have they can reach to the agencies or institutions that usually were really hard to get, that even the meetings were more productive and more goal-oriented, because you have a scheduled time and everyone are really aware of the things that they need to achieve. So this is a really good outcome of this kind of work. Also, internal functioning of the organization in terms of the team meetings, reducing times and costs for travels, and also communication is reported as really that they were benefiting out of this way of working, and different ways of engaging men. A lot of programs who tried out online programs have found that they can engage men in some other way, using different videos or different ways of exercises, and so this is something that we should also keep in mind. So although we do have a lot of challenges that we really need to be aware of, and although we have a really rich practice of how to mitigate these challenges, these good outcomes are really also important to keep in mind and to think of them as something to take away after the pandemic is over, but also when we are thinking about what model to apply even in the COVID-19 work. So talking about the bright side, I will stop here and then also move to the open questions. And you will see that this is something that we covered in the guidelines as a special toolkit and a special part of it. We noticed and mentioned it a few times, and this is something that you also are aware of when you're talking in a small groups, how different our practices now are. And although we were facing similar things, we had really different situations, different measures, different stages of the lockdowns. And we really developed a variety of models and practices and tried out different things. But as we also mentioned, the research is not still available and we can't really tell if some of the things are really working or not. And lots of it is really grounded on assumptions. So we want to keep this focus on that these are the assumptions and to encourage the discussion around the models and practices that we have developed. But we would like to highlight some of the really specific assumptions that we saw that were overarching different models and different practices of different organizations, and to go from these open questions to some new ideas how to use it in the practice. So I will mention a few of them in the next slide. These are some of the assumptions that we got from the practitioners and their practices, and the models that they were applying are built on these assumptions. So I will explain them briefly and then we will have a chance to discuss it all together. So if in-person work is not possible, because if it's possible, then we are doing what we already know well. But in cases when this is not possible, some of the programs had the assumptions that it's safer to apply phone interventions than online work. So when having all these challenges in mind about how to ensure safety, how to make sure that the perpetrators are not using this space in a potentially dangerous way, and all the challenges that we were listing, some of the programs had this assumption that it's safer to do phone interventions than to engage in an online work. They thought it's too risky. Also, some of them thought that it's safer to put a man on hold than to engage him in an online work until we can go back to in-person, or that it's safer to organize individual online work than group online work. So they shifted into online, but into the individual format, not in the group format. Also, although we all know, and as WWP, we really strongly stand behind the victim-oriented perpetrator work, and that perpetrator programs need to be linked with victim support services, and that this kind of support really needs to be offered. In the COVID-19 circumstances, some of the programs even had one additional step in this, and they were thinking that if from any reason a victim can't be involved in the victim support service, for example, she doesn't want to, or she can't, or whatever the reasons are, then it's not safe to do the online work, because then you really don't know if it is something that's really damaging for her or more dangerous, and so on. So they decided that to make it a condition for an online work to have a victim feedback and to have her on board with the victim support service. So these are all assumptions. that we would like to reflect on, and in our guidelines we have a really interactive way on how to invite you to reflect on all this. So just to start this reflection, we will do it now all together in the breakout rooms, and I will show you, if you could just, Lorna, unshare the screen. Yeah, thank you. So I will show you how to do it. So although these assumptions and this task is quite complicated itself, we decided to make it even more complicated. And if all of you who are missing in-person work miss the chance when you have really fruitful discussions in the breakout rooms to write them in a flip chart, and then to take this flip chart and use it and show it to everyone and to build on it, we have a good way how to do it even online. This is Padlet, what you're seeing on your screen. So I will explain you how it functions, and you will have a chance to try it out in case that you already did not. So first I will tell you what will be your task. So you will be divided into the 4 groups. You will stay into the same groups, and each of you will get one of the assumptions that we previously mentioned. So group number 1 will get this assumption: when in-person work is not possible, conducting perpetrator work via phone is safer than the online intervention. And you will have a task to think about pros and cons of this assumption. So when thinking about this, what arguments can you list as, yes, this really supports this assumption? Or what arguments can you list as, no, I don't think that this is the correct assumption? So you will think about pros and cons in your group and write it here. How do you use Padlet and how do you write? You see this little plus here under the column. So you just click on the plus and you get a, square where you can write, and you can write really easily. For example, pros, and then list pros. So this is 1, this is 2, this is the, then you can also add another one and write. So each of the group will work on their column and list on their column. We will be able to see it all together and to have all your valuable inputs in this Padlet. I guess that you all feel frustrated because you were really into the discussion and then we had to cut it. We did it because we don't have time, but basically we really wanted to start the discussion and to make you to think about all these important things, and then to use all this energy to go through the toolkits that we prepared and to continue the discussion. I saw that you started to write some of it. We need a lot of time to really elaborate on each of those. So I would like to encourage you to continue this kind of reflection and discussion within your teams and your organizations. And also our toolkit can be a real support in this process. So I will hand it over to Alessandra so she can guide you through the toolkit and give some final conclusions.
Okay, so at the beginning of the presentation, I said that one of the recurring questions was, does online work the same, better, worse than in-person work? And I said that maybe we should be rephrasing and changing the question. And I anticipated that we would get back to that question. So I think that our idea is that maybe Lorna, the previous slide, the question is on how should we evaluate and conceptualize the ongoing interventions and treatment that have occurred over the course of the past year? So maybe the question that we have to focus on is whatever we have been doing over the course of the past year, so there are two basic elements of this. One, whatever we have been doing over the course of the past year, if there has been an ongoing relationship with our clients, has become an intervention. So if we've been doing holding for a year, if we've been doing crisis intervention for a year, we have been doing some kind of intervention. And so we kind of have to look at what the things that we have been doing are about and reflecting on those. The second element is that it's very hard to be able to understand how the programs have divided the time that show sort of beginning and end of programs, because the programs have been shifting so much. So the framework that we are suggesting is to look at an intervention ranging over the course of the whole year. And in doing that, the questions that we have are about how do we critically reflect on the interventions that we have been delivering? How do we elaborate for the mitigating factors if there are possible risks? How do we engage with the changes that also may be have long-term effects? So how do we conceptualize? How do we move forward on this? So we sort of need to keep together these two aspects. One, evaluations that range over the course of the last year, and asking questions that allow us to critically reflect on what we're doing and move forward. So for this reason, the structure of the toolkit, the practice toolkit that we are sort of presenting today, moves from a self-reflection on the services providers, on the services that we've provided, and that has to do with questions around how we changed the intervention, what kind of intervention we were doing, how do we provide victim safety if we changed intervention, but how did we provide victim safety even if we didn't, because the circumstances had changed. But also some questions around looking at our intervention as if it's a whole block over the course of the past year. So how many men were in the program in March 2020 that are still in the program? Have we conducted a follow-up with men that may have terminated, I don't know, 4 or 5, 6 months ago? Are there things that we need to integrate because of the structure that we had over the course of the year? So could we consider that maybe if we've done mostly phone or mostly online work, there's certain things that we will need to integrate after? And to do that, we need to be able to ask those questions. And that takes us back to sort of the process that we went through in the course of this morning, linked to the reflections on the challenges and what possible mitigating effects of these challenges are. And then on final reflections on challenging ourselves, questions that you were reflecting to in the last group that we were looking at together. So phone interventions, why is it really more safe than online interventions? What am I seeing less of on the phone? What am I seeing more online? And just questioning our assumptions so that we can move forward and know more about how we are doing our various activities. So sorry if this has been slightly frustrated because we kind of zoomed through it, but on the other hand, we really wanted to thank you for being here today and hope that you have become really curious about the revision of the practice toolkit. We have done our best. Some of the service providers says you have to make it more user-friendly, more interactive. So we've really tried very hard to give it a very interactive and user-friendly structure. As you see, this is the front page. You can click on any of the different toolkits and it will take you directly there. And it sort of reflects how we have gone through it today. So thanks again to everybody for being here, for Berta and Sandra for being sort of our rocks, and for Lorna for helping us out on everything. And obviously we are really, really looking forward to having your feedback and input and ideas. So this is like first revision, but we really don't know how many more revisions we're going to have to go through and how many more thought process and changes we're going to be dealing with. So we are more than happy to start collecting rounds and inputs and ideas for moving forward. Lorna is now putting in the chat the link to the toolkit. So, and you can get sort of a first look, and then I think it's going to be officially on the website tomorrow. Also, I just want to remind everybody that today our a call for applications for our annual conference workshops went out. So make sure you read that and check on that and provide us with ideas for the workshops. It's very clear topics and issues that we are aiming for, so make sure and carefully read through it. And looking forward to catching up soon on our next adventure, whatever that may be. Thank you all.